Metal detectors and heavy security in schools can actually harm the learning environment. When students enter a building that feels like a secure facility, stress increases and trust decreases. Research shows that overly monitored schools often make students feel less safe, which can hurt learning and increase anxiety. Adding armed guards or giving teachers guns creates even more risks. Guards have not always prevented shootings, and arming teachers could lead to accidental shootings, confusion in emergencies, or weapons ending up in the wrong hands. Teachers already have demanding responsibilities, and expecting them to act as police officers could make schools more dangerous. The main problem is how easy it is to get firearms, especially high-powered ones. U.S. gun laws are weaker than in many other countries, with lower gun deaths. Stronger background checks, waiting periods, and safe storage laws have been proven to save lives. Combining these laws with better mental health support and early intervention can reduce gun violence without turning schools into prisons. Free government-run healthcare sounds appealing, but it risks long wait times and lower quality care. Countries like Canada and the United Kingdom often experience delays in specialist visits and surgeries because government limits spending. If the U.S. adopted a similar system, patients might not get care quickly enough, which could worsen medical conditions. A fully government-controlled system could also slow medical research. The United States leads the world in the new treatments because private companies invest heavily to develop medicines. Taking over the system could reduce innovation and limit breakthroughs. Instead of a total takeover, the government should reform the existing system. Measures like lowering drug prices, expanding insurance options, and supporting low-income families improve access while protecting innovation and choice. Safe consumption sites for drug users risk normalizing dangerous behavior. Even if the goal is to prevent overdoses, these sites might make drug use seem acceptable. Young people may think addiction is tolerated, which undermines prevention efforts. These facilities also require taxpayer funding that may argue should go to rehab, counseling, and education. Helping people quit drugs instead of continue in use. The addiction crisis is fueled by opioids, fentanyl, and other drugs, but supervised consumption sites do not address root causes like poverty, trauma, or lack of mental health treatment. They also do not require users to enter treatment, so they do not break the cycle of addiction. A more effective solution is to expand rehabilitation programs, improve mental health care, support prevention initiatives, and strengthen law enforcement against illegal drugs. These strategies promote long-term recovery and responsibility while reducing harm before addiction becomes deadly.